Good evening, everybody. Today's live chat is on egg donation. This is an important topic because egg donors and egg donation is a very commonly performed procedure these days. So I have some frequently asked questions which I'm going to answer. And if you have any questions, please type them in so that I can answer them after the session is over. So first of all, the most common question is, what is egg donation? So egg donation is when we take eggs from another person who is an egg donor and fertilize these eggs with the husband's sperm and make embryos. And these embryos are then transferred back to the recipient or the wife who requires an egg donor. So this is egg donation. So when do we advise egg donation? See, egg donation is normally advised as a last resort. First of all, the commonest reason why we advise egg donation is because of the age of the woman. So if a woman is 40 years or older, then there is a likelihood that she will need an egg donor because either her egg numbers will be very low or her egg quality may be very poor, or the egg numbers are low and the quality is poor, which is usually the case. Now, looking at egg numbers, a female baby has the highest number of eggs when she is in her mother's uterus or womb. At about 20 years of intrauterine life, a baby girl will have about 6 to 7 million oocytes or eggs. This number is the maximum at about 20 weeks. And after that, it keeps reducing. And by the time the baby is born, she has about 2 million oocytes in both ovaries put together. By the time she reaches puberty, a girl will have only 300,000 to 500,000 oocytes or eggs. And this number thereafter keeps diminishing, and it starts to diminish very rapidly after the age of 32 years, and more steeply after 35 years. And by the time a lady is menopausal, she has no eggs. At 38 years, a woman is likely to have about 25,000 eggs, which is a low number compared to the initial number of eggs she started again. So as the egg numbers decrease, there is also a decrease in egg quality. That's the reason why women who are older tend to more commonly have miscarriages. And also women who are older tend to have abnormal babies, like, for example, Down syndrome is more common in women who are above 40 years of age. So in these circumstances, this is the commonest reason why we advise egg donation. The next reason is sometimes younger women lose eggs rapidly. 1% of 1 in 100 women who have completely lost all their eggs before 40 years of age. And that is called premature ovarian failure. And many women have diminished egg numbers much before 40 years of age. We still don't know what the reason is, but most likely the cause is genetic, or it could be because of autoimmune diseases. But usually the cause is unknown. The next reason why we advise egg donation is in women who've had repeated poor quality eggs when we do IVF. So in these women, when we do an egg pickup, we find the egg quality is poor and eggs do not get fertilized as expected, and sometimes they arrest, the embryo arrests, so they have poor quality embryos sometimes. So these are the reasons, this is another reason why we advise egg donor in women who have repeated poor quality eggs and who undergo treatment for infertility. The next is in women who have repeated miscarriages. There are some women who repeatedly have miscarriages, but everything seems to be normal. And sometimes we have to look at an egg donor for these women. And so do women who have recurrent implantation failure. So we keep doing IVF, but they don't get pregnant. And there's no other reason we can find. Sometimes we may suggest an egg donor. And also, obviously, in women who have genetic diseases. So in these women, to avoid this transmission to the baby, we may advise egg donation. So these are some of the reasons why we advise egg donation. Sometimes, very rarely, women may be born with a normal uterus but without ovaries. For example, women with Turner syndrome, which is a chromosomal condition. So once again, these women, they have no eggs, so they can get married because they usually have a functioning vagina, and they can have intercourse, but they will need help for pregnancy. And in these women, we advise egg donation. So these are the various reasons why egg donation is advised. Now, how do we select a donor? When a couple need an egg donor, they're very concerned and they wonder how we are going to select a donor. Now, donors are anonymous, so they will remain anonymous to the recipient, and the recipient will remain anonymous to the donor. Except under certain circumstances where a donor is actually brought by the lady herself, either her sister or cousin who is willing to donate. So most often we get donors who are anonymous, and all these donors are usually less than 30 years of age, somewhere between early 20s to late 20s, have had one or two children of their own, so they have proven fertility, and they have a good ovarian reserve, and they are healthy, and they have healthy children too. So detailed history is taken, and we screen them for all infections before we take them on as donors. And certain non-identifying details will be passed on to the recipient. For example, their height, their weight, their complexion, things like that will be passed on. So these are non-identifying details. So this is how we select egg donors. So once an egg donor is selected, now how is the process done? So once again, it's a regular IVF process. When the egg donor has a period, then we start stimulation on day 2. So it's usually easier to stimulate egg donors because they've had pregnancies before, and they usually tend to produce a good number of eggs, and the eggs usually tend to be of good quality. So once the follicles have all reached the desired size, we give them the trigger injection. And on the day of the egg pickup, we ask the husband of the recipient to come over, and we collect sperm and fertilize the eggs. And we're usually able to transfer good quality blastocysts to the recipient in a later cycle. So this is the process of egg donation. Now, you might wonder what the success rate of egg donation is. It's not 100%, but it is very good. It's usually about 70, 75 to 80%. So then you might wonder why the remaining 20% or 15% of couples don't get pregnant, or women don't get pregnant despite an egg donor. So in these couples, there may be, or these women, there may be other causes. For example, the sperm may be of very poor quality, and therefore they may not get pregnant. We usually, in these circumstances, check the woman's uterus and make sure there is no abnormality in the uterus. And if there is a problem, we usually do a hysteroscopy to see if there's any problem, which may be contributing to their failure. And nowadays there is a test called endometrial receptivity assay, wherein we can actually assess the receptivity of the lining by a special test. And then we can define when exactly to transfer the embryo and when the receptivity of the endometrium is maximal, so as to enhance your chance of getting pregnant. So this is a short overview of egg donors and egg donation. So I thank you all for your listening.